During the consultation, I'll usually go over what to expect the day of the surgery. And basically, the preparation that's needed, we need a patient to be medically cleared for surgery. Usually rhinoplasty is performed under anesthesia. It's a light anesthesia using IV sedation, sometimes general anesthesia, but it's done in an operating room, and usually the patient's asleep for 2 to 3 hours. So it's important to have medical clearance and make sure that it's safe to undergo the surgery. The day of the surgery, we actually have the patient arrive early in the morning, having not eaten anything after midnight. It's important not to have taken anything that may thin the blood for about a week before the surgery, so no aspirin, Advil, or Motrin, or things like that. We have the patient come in, and the patient's greeted by a nurse in the outpatient surgery center where a history is gone over, and the patient's allowed to change into a hospital gown and made comfortable. An anesthesiologist will then come and greet the patient, again go over their history. And really the only thing that a patient feels the day of the surgery is a little numbing medicine being put into a vein in the hand by the anesthesiologist or nurse. And an IV is started, and then we just get the monitors on the patient, including blood pressure cuff, EKG monitor, and oxygen monitor. And then once we're ready to go, usually I'll come in about 10 minutes before the patient's ready to go to sleep and go over things with the patient again and reassure them that everything's going to be okay, go over their needs and their wishes. And then when we're ready to start, we just tell the patient, think of your favorite place, pleasant dreams. They get a little bit of IV medication, which just lets them go to sleep pleasantly. And in terms of the patient's experience, it seems like they're asleep for a minute, and then they're waking up being told, open your eyes, we're all done, and there's your new nose. So when the patient wakes up, there is tape on the nose with a splint and a little gauze pad called a mustache dressing to catch any drippage of either mucus or drops of blood. And that is changed probably every 20 minutes to 2 hours, depending on how it's necessary. The patient's taken from the operating room to the recovery room, where it takes about 5 to 10 minutes to wake up. At that point, a parent or friend or spouse is then allowed to stay with the patient in the recovery room, probably for about another hour, at which time the patient is sent home. Once the patient is sent home, they're instructed to keep their head elevated above their heart. We like to give patients instructions, full instructions to follow, but basically a baggie of frozen peas is good to have in the refrigerator, as a few of them, so that one's kept on the nose for 10 or 15 minutes, and then off for 10 or 15 minutes, and then you can alternate them and refreeze them. It conforms well to the bridge of the nose and the eyes. By keeping the head elevated and keeping the cold on for the first 2 days after the surgery, it helps to keep swelling down. Again, the mustache dressing is changed as necessary. Patients are told to stay in bed the first day or two. Many surgeons will use packing in the nose. Personally, I don't use packing. I think it's very uncomfortable for patients, and instead what I use is absorbable sutures that hold things in place. Patients are seen 2 days after surgery in the office, at which time the inside of the nose is cleaned and the little bit of tip tape that's around the nose is taken off. Patients want to know what's it feel like after surgery. Is it painful? And really the discomfort level is minimal. Usually just plain Tylenol is enough to get them through, although patients are given a narcotic just in case they need something before they go to bed. They're instructed to make sure that they have something in their stomach before they take that medicine. And but for the most part, people say it just kind of feels like a sinus pressure headache at the worst. So after they're seen 2 days after surgery, again the nose is a bit stuffy, and that stuffiness is improved after we clean it up. But for the next 3 days, it kind of still feels stuffy. We then see the patient at 5 days after their surgery, at which time the splint is taken off, the tape is taken off, and there's your new nose, which is always our favorite part of the procedure. There's nothing like showing a patient their new nose. Again, at that time, the nose is cleaned, and the breathing improves greatly over the next few weeks.